Hello, my name is Megan McCreary and I'm from the University of Alberta. Today I'll be talking about the ARCTICC study, a controlled clinical trial looking at the use of an electronic incontinence identification system in nursing homes. I have no affiliations to disclose. Funding for this study was provided by Essity Health and Hygiene. Urinary incontinence occurs in 43 to 79% of nursing home residents. For many, it is an embarrassing condition that challenges personal dignity and adversely affects quality of life. The majority of nursing home residents are currently managed by an ask, check, and change method, but this is labor-intensive and often leads to suboptimal delivery of continence care. The potential for technological solutions to standardize continence assessment and facilitate improved management has rarely been explored. So this study compared the use of an electronic incontinence identification system to usual care practices in a single nursing home. We looked at the effects of this system on the quality of continence care for residents, as well as continence care related resource use. This was a prospective, quasi-experimental, controlled clinical trial. The intervention we used was called TENA Identify. This is an electronic monitoring system where a continence pad records a resident's voiding patterns over a 72-hour period. This information is then used by nursing home staff to create a continence care plan individualized to that resident's needs. The study took place in a single nursing home and enrolled residents over age 65 who were eligible for a continence assessment. There were two separate wings in the nursing home, one for the usual care group and one for the intervention arm, with little staff crossover between these wings. The primary outcome of our study was a between-group change in pad absorbency. We also looked at several other secondary outcomes as listed here. In a previous study, the proportion of residents able to reduce their pad absorbency by one category was 35%. With an estimate of 10% similar change in the usual care group, an alpha of 0.05 and a power of 0.8, the required sample size for each group was 43 residents. In total, 46 residents were recruited to the usual care arm and 43 to the intervention arm. At baseline, these groups were not well matched. The control group had statistically significant fewer number of day pads used, lower total absorbency of day pads, lower daytime cost, fewer pad leakages, and less reported time spent on continence care. So this actually suggests that the intervention arm was more resource intensive and included residents with more severe incontinence. We took this into account when analyzing the between group change. This study reached its primary outcome. At 8 weeks, there was a statistically significant change in the proportion of residents achieving a reduction in 24-hour pad absorbency, favoring the intervention arm. Other between group changes are shown here. Statistically significant changes included the absorbency of night pads used and total cost of pads used at night, again, with both results favoring the intervention arm. Within group changes for the intervention arm are shown here. Between baseline and end of study, there were statistically significant reductions in the absorbency of night pads used, total cost of pads used at night, and 24-hour pad leakage episodes. There was also a statistically significant increase in resident reported quality of life. Apart from an increase in reported quality of life, there were no statistically significant changes between baseline and end of study in the control group. I should also note here that the mean time to construct a continence care plan using the Identify system was 4.9 days. So what does all this mean? Use of the Identify system resulted in significant differences in the absorbency and cost of pads at night, allowing for more appropriate pad usage. It also resulted in fewer pad leakages and reduced time spent on continence care. However, these changes did not reach statistical significance. One limitation of this study is that it was conducted in a single nursing home, so our results may have limited generalizability to other centers. Another limitation is that, as we noted earlier, there was a difference in the control and intervention groups such that they were not well matched at baseline. However, we took this into account when doing the between group change analysis. Thank you very much for your time. Please feel free to leave any questions or comments for us. We would love to hear from you. Thank you.